welcome to IPO Day of CEO Interviews, special series from Seeking Alpha. Great to have you on. Welcome and congratulations on the IPO.
Thanks, Rena. It's a really big day for our physician partners, for our employees, and for the communities we serve. We're just really excited about it.
It's really exciting. Talk to listeners or viewers that may not know exactly what Agilon Health is and what you are bringing to the marketplace. You want to give us a brief rundown on what you guys represent and what part of the healthcare sector you play in?
Absolutely. So at Agilon, we're a 4.5-year-old company, and we partner with primary care doctors to give them the time, the resources, and the tools they need to really meaningfully improve the health of their senior patients. So we're focused on that over 65 senior patient in Medicare Advantage, which, as you know, is a really large and growing program. And we're really focused around this idea of the primary care physician can be that care quarterback and can really meaningfully improve the health of these seniors. And we've seen incredible results. We're in 17 communities. We have 200,000 Medicare Advantage patients that we're serving. And primary care is increasing significantly, and we're seeing 30 to 40% reductions in emergency room and hospital visits. So it's a very impactful model. And I think one of the unique things about what we're doing is we are partnering with these primary care doctors and groups who've been in their communities for decades. So they're really well respected and known, and they have the most important thing that you need in healthcare, which is a trusted relationship with their patients. What they don't have is they don't have the time to take that holistic view with their patients. They don't have the information to understand what happens outside of their office, and they don't necessarily have the tools and the resources to drive some of the changes in the broader healthcare system. So that's what we do. That's what we do with our partnership approach. And it's been very compelling so far, and we're excited to take it further.
And it's been quite in the healthcare sector. You know, it's an unprecedented year in terms of COVID, and it seems really a unique time to be addressing the needs of seniors in, specific communities. Has that been a part of why you've decided to go public now? Do you feel like this is a time to kind of reach out and extend and expand? Is that part of it, or is there another reason why now is the time to go public?
Well, I think now is the time because we've just got so much momentum. And that we have a network of physicians that we've built across these 17 communities. There are literally hundreds of communities out there with primary care doctors and patients looking for a partnership approach like this. Medicare Advantage and Medicare is growing so dramatically. 10,000 people a day are turning age 65, entering the Medicare program, and it's really pressuring these communities. The other issue we're dealing with is physician burnout, and specifically primary care burnout. And our model, by bringing them the time, bringing them the resources, really resonates with these physicians. They love it. Their patients love it. And so I would say that momentum and the need is the why now. There's an urgency to what we're addressing. As to your COVID question, COVID has impacted seniors disproportionately. They're the most at risk, not able to leave their homes. And so what's happened from our perspective with our partners is we've been innovating. So telehealth has become a major vehicle for delivering care to these patients. If you went back to January of 2020, our physician partners had maybe 1% of their visits via telehealth. Today, it's in that 15 to 17% range, and it's going to be an ongoing component of that patient-physician relationship. And it's not just people who are avoiding going to the emergency room or kind of core primary care. It's chronic folks who need this as part of their medication adherence or follow-up so they stay on their care pathway. So it's a confluence of things, what I say.
And, you talked about bringing the community, some of the community of physicians with you on today as you went public on the New York Stock Exchange. Talk to me about what the feeling is amongst the group and how you feel, you know, the evolution of your journey until today, the excitement level, and what are you guys excited about bringing to the market in this next iteration?
Well, it's been incredible to bring together our partners from all these different communities. They are so proud of what they've done in their own communities, but they're really proud to be a part of this network. You know, our mission is really around transforming healthcare at the community level, and they're the leaders in their communities. So they have immense pride in the impact that they're making, and they have immense pride in being part of this larger network and having a national impact, because that's really where we're starting to go. And I think for the next leg of this journey, like I said, there are so many communities that can benefit from this model. There are so many physician groups who've been in their communities for decades who really need a partner to help them broaden their impact. We're investing in primary care. In these communities, you're seeing primary care grow for the first time in decades. It's been declining. It's a real issue in the country. And so the ability to improve health of seniors, invest more in primary care, and really be a part of that broader solution locally and nationally is all about what we're trying to do and why our partners are so fired up about it.
Something that it seems about successful companies or companies that are building a successful model, it seems that they already have predicted a certain change in their industry and have acted accordingly before kind of they need to. And it seems to me with this unprecedented year and with all the problems surrounding seniors specifically, as you mentioned, was it kind of a doubling down this year of the ethos that you had already established? Or was there some discussion of needing to pivot in some way given all the rampant changes? Or do you feel like you guys were set up already for what was coming and it was just a matter of kind of honing in on what you already had?
Well, I think we're very clear about our mission about being these trusted partners to the community-based physicians. I think we were very clear about how we were trying to partner with primary care doctors to transform their communities. So that was very clear. I think that the acceleration that we're seeing, whether it's from just the need from these communities or COVID putting more pressure on seniors, it's a little bit hard to separate those two. But for us, the opportunity is just so great, but we've had to be nimble, right? My point about telehealth, you know, in several of our communities, we identified that senior patients didn't have smartphones or iPads. And so they couldn't do telehealth visits. And so what we created was parking lot medicine, where literally we would have seniors drive to their parking lot. We would have staff with PPE giving them sanitized iPads and having a visit with their primary care physician. And it was, I mean, it was incredible, sort of the impact that it had and just how many seniors came out for that and how thankful they were. You know, one of the things that was incredible was we measure satisfaction at the patient level. And as crazy as 2020 was, the satisfaction level went up in 2020 from our patients. You know, world-class levels, better than like Apple or Southwest Airlines. And in healthcare, it's really, you know, the very best. But what they said was, you're taking care of me. It's simple. I can understand it. And so I think we saw a trend. I think we saw the right people to build around. They're in every community in the country. They just need time and resources and tools, and we provide that to them. And so we're excited about where we're at and where we're going.
The other thing I wanted to ask about is the strength of your board and your team. Primarily, the chairman of your board is Ron Williams, who is kind of, well, he's known as the former CEO of Aetna in the healthcare sector, but across multiple sectors, he's known as, you know, a renowned business and thought leader. Is that somebody that you're leaning on in terms of guidance? Are you in, you know, close discussions with him? How much has that helped guide what's happening at Agilon?
Absolutely. I mean, we have a tremendous board. Ron, I've known for 20 plus years. And he was one of the first people that talked to me about the opportunity at Agilon in the very early days. So he's been tremendous for us, but the entire board has been great. We've got a mix of physicians who are in their communities. We've got a mix of excellent business people. Ravi Sachdev, who's our vice chairman and the founder of this business. You know, between Ron and Ravi, we're talking every single day. It's just such a dynamic time. And I think the momentum we're building is incredible. And so we want to make sure that we're nimble. We want to make sure we're making good decisions, but we're also being bold in terms of how we're approaching the future as we see that opportunity just continue to expand.
And given that this is a CEO interview series, I wanted to ask you a question about if you feel like there's a different skill set that's needed between the private and the public markets.
So I don't necessarily think so, Rena. I think, you know, you need to be very clear about your strategy. I think you need to build a great team. I think you need to have, you know, an excellent culture in which people work together really well. We believe in up-tempo. We believe in being a learning organization. I say to everyone that comes here, I want you to feel like you've got incredible opportunities here and that you can grow for a long time. I think that's true in a public company or in a private company. And there are some differences, but in terms of tomorrow versus yesterday, we're going to keep doing the same things that we were doing, focusing on improving patient care for seniors, focusing on putting our primary care doctors in the most successful place. So I don't think there's some technical differences between them, but at the core and what you need to do to build a successful business, I think there's a lot of similarity.
And this is going to be my last question. What do you think is something about Agilon that is either underappreciated or overlooked by the marketplace?
Well, I think what has become increasingly appreciated over the experience over the last few weeks is just the power of how our model can move from one community to another. What we're doing is very difficult in healthcare. There aren't physician-centric organizations that have been successful in so many different communities, and we're working with larger groups, we're working with smaller groups, we're working with primary care only groups or multi-specialty groups that are primary care centric. And so the ability to work with that sort of diversity of groups and markets, for lack of a better term, I think is really unique. And so that has become very appreciated as we've gone through this process. And we're a very efficient organization. So the way we're able to enter into a partnership is very capital light. The ability to get a partner and a market to profitability within a couple years is, I think, really unique. And so all of those things I would call out as sort of key to what we do. And it's really come through in these last couple of weeks.
Well, Steve, this has been a pleasure. Again, congratulations on the IPO. I'm excited to talk to you down the road, see where you guys are, catch up with Agilon in the marketplace. But in the meantime, congrats and enjoy the ride.
Thanks, Rena. Great to talk to you, and let's go AGL. Thanks very much.
Absolutely. Nice to talk to you, Steve.